A record number of COVID-19 cases reported across Indiana. More than 12,000 new cases. That's the highest number of any single day during the pandemic by thousands of cases. The previous record was more than a year ago. It comes as hospitals are struggling to stay afloat. They're over capacity, understaffed, and overwhelmed. And now they're calling on the Indiana National Guard to help out. Monday, guardsmen are expected to arrive at Eskenazi Hospital to try to relieve some of the pressure from staffing shortages because of this latest COVID surge. The hospital's executive medical director says staff is exhausted. Some are actually getting sick themselves.
Our staff are developing breakthrough infections, so they've been vaxxed and boosted, but they're testing positive, which we know can happen with Omicron, and then they can't work. I'm receiving calls from all over Indiana, including some from Kentucky and Illinois, asking, begging for us to take patients in critical care transfer because there's simply no beds, no access to critical care.
Despite the long road ahead, Dr. Graham Carlos says healthcare professionals are still showing up, taking extra shifts, going above and beyond what they signed up for. With a surge in cases and hospitalizations comes right as students get ready to head back to school next week. State health leaders talked with school administrators about the latest numbers and the new CDC quarantine guidelines. Our Gina Glero says basically staying in class comes down to masking up and getting vaccinated.
All I can tell you right now is buckle your seatbelts. It's going to be quite a ride.
Deputy State Health Commissioner Pam Pontones walking schools through the new CDC guidelines for students and educators starting Monday. For schools with a mask requirement, if a student tests positive in class, the student should stay home for 5 days, returning on day 6 with a mask. If a student is exposed in class, no need to isolate. If exposed outside of class and fully vaccinated, no isolation. If unvaccinated, stay home for 5 days. For schools without a mask requirement, if a student tests positive, isolate. A student who is exposed outside of school and fully vaccinated does not need to isolate. If unvaccinated, stay home for 5 days. The Indiana Department of Health expects to receive more specific direction from the CDC.
Those guidance documents are underway literally as we speak. Believe me, states have been clamoring for them.
A reminder, anyone older than 2 who are able should wear a mask. They're mandated on the bus and should also be worn during extracurricular activities. IPS released a statement saying it's monitoring the latest guidance. Quote, "We will communicate any updates to our protocols with our families soon." Pontones stressing this is early information.
Please understand, more to come. Some of this may tweak or change in the next week or 2, but we are riding through this together. We will continue to do so until the very end. And thank you so much for your partnership, your energy, and your dedication.
Well, Monday, the FDA is expected to broaden eligibility for Pfizer boosters to kids ages 12 to 15. Teens who are at least 16 years old have already accessed the booster shots. The agency is also expected to move up eligibility for adults hoping to get a Pfizer booster shot from 6 months after their second shot to 5 months after their second shot. Studies have shown a booster dose increases protection from Omicron variant of the coronavirus significantly.